Signs and symptoms of Alzheimer's and what to do. From thinking and remembering to memories and emotions, everything you experience is controlled by your brain. The different parts of your brain are responsible for taking control of your personality and actions. If something were to happen to these areas of your brain, you'd lose essential parts of your personality and everyday functional activities. Have you ever wondered what could happen if your brain shrunk? Well, that's what happens in Alzheimer's disease. Alzheimer's is a neurological disorder in which the brain cells shrink and die. It is caused by an abnormal buildup of proteins around the brain cells. These proteins, including amyloid and tau, form plaques and tangles within the brain. Memory loss or dementia is one of the most common manifestations of Alzheimer's disease. It often presents as an early symptom. The leading cause of memory issues is continuous and progressive damage to the brain cells. In the early stages, people having Alzheimer's face difficulty with short-term memory only. They may be forgetful of where they placed their things and forget the basic stuff they are used to having by their side during daily activities. Though anyone can be forgetful from time to time, continuous forgetfulness may indicate Alzheimer's. People with Alzheimer's often suffer from poor judgment. The brain is responsible for analyzing the pros and cons of different situations and making decisions accordingly. Therefore, damage to the brain cells due to Alzheimer's results in the loss of sound judgment and informed decisions. If a loved one goes through Alzheimer's disease, they may be unable to evaluate different factors that play an essential role in the decision-making process and may make poor judgments. It takes longer for Alzheimer's patients to complete regular tasks. With progressive brain damage, the ability to perform everyday activities is significantly reduced. It takes longer to process information and memory. As a result, it takes longer to complete even the most simple of tasks. A person with Alzheimer's may have difficulty in going and fetching a glass of water, while it takes only a few moments for a healthy person to perform this activity. Alzheimer's affects the ability to remember, so forgetting recent activity or conversation is often one of the first signs of this disease. People with Alzheimer's forget what they've been told and keep asking the same question again and again. They can't seem to remember a fact even if it is repeated many times. Getting lost while traveling long distances or in unknown locations is common, but familiar places and everyday routine navigation down the block are easy to remember. However, people with Alzheimer's are unable to recognize familiar faces and locations due to dementia. As a result, they often get lost after the onset of this disease, even if they have been there multiple times earlier. Facing difficulty in activities of daily living, being unable to perform usual activities, and forgetting familiar faces can result in varying mood and personality changes in people with Alzheimer's disease. If a family member or a loved one has Alzheimer's disease, you may be able to witness constant irritability, moodiness, loss of motivation, and other changes in their personality. Sometimes the thinking and behavioral patterns result in anxiety and aggression. Alzheimer's patients may also have hallucinations and delusions. A hallucination occurs when there is no external stimulus, but your brain makes you perceive it anyway. A hallucination can be visual, or it may involve your hearing and smell. On the other hand, delusion occurs when your brain misinterprets a stimulus. You may mistake a rope for a snake, for example. Hallucination and delusions arise in the late stages of dementia and Alzheimer's. Alzheimer's disease may cause communication problems and difficulty in socializing. Alzheimer's patients struggle with the ability to communicate effectively as it destroys their brain cells. Resultantly, one loses the ability to speak and to understand speech, an inability called aphasia. Aphasia can worsen as the disease progresses. Alzheimer's causes difficulty in remembering the right words and interpreting what others are saying. Anyone struggling with this disease may struggle to find the right words or forget the things they want to say. Swallowing problems are common in later stages of Alzheimer's disease. As the disease progresses, the patient may forget to chew or swallow the food in their mouth. This is an alarming and serious situation. Inability to swallow food properly can lead to choking or accidentally breathing it into the lungs. This can result in aspiration pneumonia and even result in death. The signs and symptoms of early Alzheimer's disease may vary from person to person, but an early diagnosis is essential to slow down the pace of its progression. If you notice any signs and suspect Alzheimer's disease, it is best to seek professional assistance instead of self-diagnosis. There isn't just one specific test for the diagnosis of Alzheimer's disease. The doctors and neurologists use multiple tests and carefully analyze the signs and symptoms to form a diagnosis. Besides detailed history and physical examination, a neurological exam and mental health test enables your doctor to make an accurate diagnosis and provide medication accordingly. The neurological examination involves brain imaging to see any damage to the brain and its parts. Additionally, doctors check reflexes, coordination, movement, and speech efficiency. These tests' primary purpose is to look out for the signs of Alzheimer's disease and rule out other conditions and dementias. Mental health tests evaluate memory. They determine if a person is able to solve simple problems and utilize necessary skills in simple activities. Mood assessment also helps to determine exasperating factors for memory problems. If a loved one has Alzheimer's disease, it can be hard for both you and them. Support groups and reaching out to family and friends can be helpful in this regard. Predictable schedules and setting plans also save you and your loved one from confusion. Alzheimer's disease diagnosis can be devastating for friends and family, but remember that the person is more than just the disease.